To treat a pinched nerve of the neck, or what I refer to as radiculopathy, two procedures can be performed surgically. One is an artificial disc replacement, the other is our anterior cervical discectomy and fusion. We don't generally do surgery as a first-line treatment if the patient tries physical therapy or tries an epidural steroid injection and still has neck pain and radiculopathy or a pinched nerve. These pain symptoms may not abate as a result of conservative care. Therefore, we try these first, and if that doesn't work, then we perform anterior cervical discectomy and fusion or artificial disc replacement.